of the day to all the learned listeners. I, Ira Chaturvedi, am here to discuss about the coronavirus disease because the best way to prevent and slow down the transmission is to be well informed about the pandemic. So, here we would be discussing from the initial following the future COVID-19, which includes its origination, how it spread in the world, its precautions, the medical inventions, to what may be the stage of COVID-19 in the future according to the experts. So, on 31st December 2019, Wuhan Municipal Health Commission, China, reported a cluster of cases of pneumonia in the Hubei province, and the novel coronavirus was eventually identified. WHO released the international community's strategic preparedness and response plan in order to protect states with the weaker health systems. Deeply concerned by the alarming levels of spread, WHO made the assessment that COVID-19 can be characterized as a pandemic as of 11th March 2020. COVID-19's Solidarity Response Fund was launched to receive donations from private individuals, corporations, and institutions, along with Solidarity Trial, that is, the international clinical trial which aims to generate robust data from around the world to find most effective treatments for COVID-19. This virus doesn't respect any state boundaries. Hence, it knocked India on January 2020, originating from Kerala. According to Michael Ryan, the Chief Executive Director of the WHO's World Health Programme, said that India had tremendous capacity to deal with the coronavirus outbreak. Protective measures were first applied in January, in thermal screening of passengers arriving from China. By early to mid-March, the government had drawn up plans to deal with the worsening of the pandemic in the country. On 22nd March, the Government of India launched a nationwide lockdown. As the end of the lockdown approached, Indian state governments recommended extending of the lockdown and letting the nation in the fourth phase of the nationwide curfew. The government divided the entire nation into 3 zones, in which relaxation would be allowed accordingly. The red zones are the major hotspots or the districts with high doubling rates and high number of active cases. The orange zones are the non-hotspots or the districts with fewer cases. On the other hand, green zones are the districts without any confirmed or new cases in the last 21 days. On a 30-minute live telecast, Indian PM Shri Narendra Modi asked all citizens to observe Janata Curfew. He also announced the formation of COVID-19 Economic Response Task Force. In an address on 14th April, PM Modi asked the citizens to follow 6 steps. Use homemade masks, take care of the elderly people, protect jobs, help the poor and needy, follow the guidelines issued by the Ministry of Ayush, and download the Aarogya app to track your health. In a live telecast on 12th May, an economic package of 20 trillion for Atmanirbhar Bharat was launched. He added that the 5 main pillars India stands on are economy, infrastructure, governing systems, vibrant demography, and the supply chains. Never in the past, researchers were pushed to their limits as they have been now. They are working overtime in order to discover a certain COVID-19 treatment. Startups and young professionals realize that this is the time when people want their creativity to come to the fore. In India, a Pune-based startup, Seagull Biosolution, has become the first company to get financial backup from the Government of India. It is using active virusome technology to develop COVID-19 vaccine. The company is basing its development on the existing measles vaccine platform. The plasma therapy is also being used as a stopgap measure. It uses part of blood which contains antibodies that attacks the specific virus. By giving these to the patient means they would not have to produce the same on their own, as these are procured with the COVID-19 survivors. This therapy is useful only if the patient is having a lung collapse or is on the ventilator. The Indian Council of Medical Research (ICMR) has carried an evaluation of 16 antibody-based rapid test kits and approved 13 to conduct the novel coronavirus test, which has served to be a low-cost, efficient testing option. All India Institute of Medical Science has set up a molecular diagnostic lab to diagnose COVID-19 cases. It features real-time PCR kits officially approved by the World Health Organization. On the other hand, Aarogya Setu has been a burning topic as a tech to combat the virus these days. Aarogya Setu, meaning Bridge for Freeness from Disease, is an Indian COVID-19 tracking mobile application developed by the National Informatics Center that comes under the Ministry of Electronics and Information Technology. This app is an updated version of an earlier app called Corona Kavach, released by the Government of India. Aarogya Setu has 4 sections. First is the Your Status section, which tells us the risk of getting COVID-19 for the user. Second is the self-assessment, which lets the user know the risk of having been infected through an FAQ round. Third is the COVID-19 update section that provides information on local and national COVID-19 cases. Fourth is the electronic pass section for the emergency travels. The app tells us about the number of positive cases likely in a radius of 500 meter, 1 kilometer and further. The app is built on a platform that can provide an application programming interface (API) so that other computer programs can make use of the feature available in the Aarogya Setu. I would also like to thank our Honorable Prime Minister Shri Narendra Modi, who is always concerned about the difficulties faced by the citizens, including migrant workers and farmers. After all, they are the backbone of the nation. Be home, be safe.